Buenas and Hafa. The Committee on Health and Veterans Affairs is now called to order. The time is 2 o'clock in the afternoon, and today is Wednesday, February 11th, 2026. Thank you all for being here this afternoon. Today we're holding a public hearing on Bill number 20628 COR, introduced by Senator Telo Taitague, and Bill 238 COR, introduced by Senator Vincent Borja. Bill number 206 is an act to add a new subsection 12202C, amend subsection 12205C, subsection 12206, and add a new 12206.1 and subsection 12207A 5 to Article 2, Chapter 12, Title 10, Guam Code Annotated, relative to building a more diverse and sustainable healthcare workforce on Guam by expanding licensure pathways for foreign medical graduates and establishing a local CONRAD 30 J1 physician waiver program. Bill number 23838 COR is an act to amend subsection 25105 of Chapter 25, Division 2, Title 10, Guam Code Annotated, relative to granting exemption of Title 26 of the Guam Administrative Rules and Regulations related to sanitary inspection requirements and for other purposes. Notice of today's hearing was provided to all senators, stakeholders, and members of the media in compliance with the Open Government Law. The notice was also posted on the Guam Legislature website and the public notice portal. All materials for today's hearing have been uploaded to the committee drive for today's hearing and are available in print if anyone needs them. A recording of today's hearing will also be available on the Guam Legislature Media YouTube channel. And before we proceed, I want to recognize the committee members that are present with us today. The Vice Chair of the Committee on Health, Senator and Vice Speaker Tony Atta, Senator Shawn Gumataotao, and Vice Chair for the Committee on Veterans Affairs, Senator Vincent Borja. Sorry about that. And we also have Senator Telo Taitague. For today's hearing, the rules are simple. Colleagues, you each have 5 minutes to ask your questions. Members of the public, please speak clearly into the microphone and state your name and who you are representing. Before we begin, please take note that if we are not finished with the hearing, we will have to adjourn at no later than around 4:45 and set another date to continue accepting public testimony. And the reason for that is that we are going to be adjourning into session to accept the governor's State of the Island address at 5 o'clock this afternoon. At 4:45, there may also be some dogs that might be coming through here because they're doing security sweep of the building in anticipation of the State of the Island. So I do encourage all members of the public and my colleagues to be mindful of the time constraints that we are up against. We will now begin with Bill 206. If you are signed up to testify, please have a seat at the table. Senator Telo Taitague, you may start with your opening remarks on your bill.
I made it just in time. Yes. Thank you, Senator and Chairwoman. Also, before I make my opening, I'd just like to ask for your consideration to have former Senator Dennis Rodriguez to go first on his testimony because he does have a prior engagement.
Sure.
Okay. That being said, Hafa Madam Chair and colleagues and stakeholders, thank you for the opportunity to present my bill, Bill 206-38, for your consideration today. Bill 206-38 intends to amend Title 10, Chapter 12 of Guam Code Annotated to expand licensure pathways for graduates for foreign medical schools by clarifying the standard and examination of the Board of Medical Examiners may accept, including recognition of Educational Commission of the foreign medical graduates, certification and equivalent international medical licensing examinations, by authorizing licensures by endorsement and special or temporary licensures where appropriated, and by establishing the Guam Department of Public Health and Social Services, so the administrating agency of Guam's CONRAD 30 J1 physician waiver program, including criteria for placement of physicians in federally designated health professional shortages and medically underserved areas. I introduce this measure in response to a growing and urgent concern I have heard constantly from physicians, hospital leaderships, and families across our island. Too many of our people on Guam struggle to access timely and quality medical care because they do not have enough doctors, especially specialists, practicing on the island. This shortage places real strain on our only public hospital, our community health centers, and on physicians who are often asked to practice beyond their intended scope because there is no one else available to refer a patient to. The result is longer waiting time, delayed diagnosis, and too often patients having to travel off island and for care that should be available right here on Guam. At its core, this bill takes a practical step toward modernizing Guam's medical licensure laws to help Guam recruit and retain qualified foreign medical graduates, many of whom are trained in the United States, certified through rigorous national standards, and willing to serve in the medically underserved areas so that we can find critical gaps in care at places like Guam Memorial Hospital Authority, public health centers, and our community health centers. I also wanted to acknowledge the current challenges at the federal level, particularly around immigration policies and physician visa waivers. The bill was drafted and introduced prior to the most recent changes in federal guidance and costs associated with the J-1 and H-1B process, which had added new layers of uncertainty for physicians and healthcare facilities alike. We know that changes and delays in these visa pathways can create real barriers for doctors who want to serve here. In that context, I note that the governor has recently raised this issue directly with federal officials, including advocating for the Guam-only H-1B visa category that would exempt Guam from the new $100,000 federal filing fee and renewing efforts to expand Guam's local visa waiver framework. These actions underscore the same recognition that Guam's unique geographically workforce shortage and reliance on immigration professionals require tailored federal and local solutions to protect access to healthcare and support our economy. This is exactly why Guam needs a clear, well-defined local program. This bill does not override federal law. It works within it by establishing the structure Guam needs so that when federal waivers and visa pathways are available, we are ready, to act quickly and responsibly to bring physicians where they are most needed. Let me address a core concern up front. This bill does not lower standards for medical practice on Guam. It maintains the authority of the Guam Board of Medical Examiners, requires recognition, certification, and credential verification, along with priorities, patient safety, and public accountability. The intent is not to bypass training or oversight. It is to ensure that qualified physicians who meet high standards are not excluded by outdated or inflexible processes. It is also important to ground the discussion in evidence. The large national study published in the BMJ, which is the British Medical Journal, in 2017, examined more than 1.2 million medical hospital admissions across the United States and found that patients treated by internationally trained physicians actually had slightly lower 30-day mortality rates than those treated in the U.S. medical school graduates, with no meaningful difference in hospital readmissions. The study concluded that there were no evidence that international medical graduates provide lower quality inpatient care, and in some cases, outcomes were modestly better. These findings reinforce the rigorous screening and licensure standards work and that internationally trained physicians who meet U.S. certification requirements deliver safe, high-quality care. For the record, I will also be requesting a technical amendment to section 12206G of the bill as introduced. That subsection was transmitted while still drafting and does not accurately reflect the role of the World Directory of Medical Schools. The amendment will clarify that the directory is a reference listed of medical schools, not a credentialing or licensing body, and that the credentialing and verification remain with ECFMG, or other board-approved entities. This is a clarification of intent, not change in policy direction. So the amendment language was transmitted to the committee chair. I'm sure you received it. So in closing, I'll leave my closing to the end, but I know it was a bit long-winded, and thank you for the opportunity to express the intent of this legislation. Thank you.
Thank you, Senator Taitague. We will now open the floor to public testimony, and there was a request to have former Senator Dennis Rodriguez start. Senator Rodriguez.
Thank you very much, and Hafaday Chairperson Matanane and members of the committee, Senator Borja, Senator Gumataotao, Senator Ada, and Senator Taitague. Thank you very much for being here. My name is Dennis Rodriguez Jr. I'm the founder of the Total Guam Foundation, a Guam-based and nationally recognized 501c3 nonprofit health and social services organization, and a former senator of the 31st to 34th Guam Legislature. I respectfully submit this written testimony in strong support of Bill 206-38, introduced by Senator Telo T. Taitague, which expands licensure pathways for foreign medical graduates and clarifies Guam's participation in the CONRAD 30 J1 Physician Waiver Program. I offered this testimony as a healthcare advocate and as part of an organization whose mission is focused on reducing barriers to care and expanding access for underserved and vulnerable populations on Guam, as well as in my former capacity as a legislator who worked on workforce policies intended to address physician shortages on our island. During my tenure in the 34th Guam Legislature, I introduced Bill 126-34, legislation intended to address Guam's physician shortage through the creation of an assistant physician licensure pathway. That proposal focused on U.S. medical school graduates who completed medical school and passed the United States Medical Licensing Examination, the USMLE, but were unable to secure a residency placement despite being otherwise qualified to contribute to patient care. The intent of that legislation was to responsibly expand access to primary care services under appropriate physician supervision, particularly in underserved communities. While that bill did not advance into law, the underlying workforce challenges it sought to address continue to affect access to care across our island today. The concept behind Bill 126-34 was not novel or experimental. According to information tracked by the Federation of State Medical Boards, the FSMB, several U.S. states have enacted laws establishing an assistant physician, associate physician, or substantially similar role as a means of addressing provider shortages while maintaining physician oversight. I've included some of the states identified by the FSMB who have enacted some of those legislations, and it's part of my written testimony. From all available data, reports, workforce studies, and firsthand accounts across, let me go back here. These statutes generally allow certain medical school graduates who have completed licensing examinations but not residency training to provide limited clinical services, often in primary care and underserved settings, under structured collaborative or supervisory arrangements. This demonstrates that the policy direction behind Bill 126-34 was grounded in existing national precedent, even though Guam did not adopt that model at that time. I share this background solely to provide context and to illustrate that Guam's ongoing discussions around workforce solutions are consistent with approaches explored in other U.S. jurisdictions. Senator Taitague's Bill 206-38 is not a reintroduction of Bill 126, nor does it replicate the assistant physician framework. Instead, it addresses a separate and critically important workforce pipeline involving foreign medical graduates. Where my prior bill focused on U.S. medical graduates without residency training and a limited supervised scope of practice, Senator Taitague's Bill 206 focused on some very important aspects. They focus on modernizing Guam's licensure statutes for foreign medical graduates, recognizing ECFMG certification and equivalent international examinations, clarifying the Guam Board of Medical Examiners' authority to assess international credentials, expanding licensure by endorsement and special licensure pathways, and establishing a clear statutory framework related to Guam's participation in the federal CONRAD 30 J1 Physician Waiver Program. These approaches are distinct, complementary, and are not duplicative, each addressing different gaps within the broader healthcare workforce. Under federal immigration law, U.S. states and territories, including Guam, are eligible to recommend up to 30 J1 physician waiver requests per federal fiscal year under the CONRAD 30 J1 Physician Waiver Program. This federal program allows foreign medical graduates to obtain waivers of the 2-year home residency requirement by committing to a minimum of 3 years of service in a health professional shortage area, a medically underserved area, or facility serving a medically underserved population. While Guam is eligible to participate in this federal program by virtue of our status, our territorial status, current Guam statutes do not clearly codify how the program is administered locally, including the agency designation, prioritization of criteria, or reporting and oversight mechanisms. Senator Taitague's bill provides that clarity, ensuring Guam's participation is grounded in local law, transparently administered, and aligned with Guam's healthcare priorities, particularly service to public and underserved populations. From all available data, reports, workforce studies, and firsthand accounts across the healthcare community, it is clear that provider shortages remain one of the most significant barriers to healthcare access on Guam, especially within the public health clinics, GMH, and other safety net settings such as the Total Guam Community Health and Wellness Center. Bill 206 offers a measured approach by aligning licensure pathways with national best practices, leveraging an existing federal recruitment mechanism, prioritizing service to underserved and public facilities, and maintaining appropriate standards, oversight, and accountability. Taken together, these elements provide Guam with practical tools to strengthen its healthcare workforce while safeguarding patient care. I commend Senator Taitague for her leadership and for advancing Bill 206-38 as a practical and forward-looking response to Guam's healthcare workforce challenges. Having previously worked on similar legislation, I understand the difficulty of striking the right balance between improving access to care and maintaining the quality, safety, and regulatory integrity of our healthcare system. Bill 208 represents an important and timely step toward addressing long-standing workforce shortages and improving access to care for the people of Guam. For these reasons, I respectfully urge the senators to support and advance Bill 206-38. Sidus Masi for your time and consideration today. And Madam Chair, if I may, just one, for consideration of the body, that I know it doesn't expressly prohibit that if this passes, that this would be that this will be solely for public health facilities or GMH, but to encourage, just to encourage some clarity, perhaps including nonprofit safety net centers like Total Guam Health and Wellness Center. There's others like the SDA that could also benefit from this, and so that's the only thing I ask the body to please consider. Sidus Masi, thank you.
Thank you, Senator Rodriguez. I guess I'll start to my right. Bistra?
Hafide, respected senators, my name is Bistra Mendiola. I'm a longtime resident of Guam and a mother of 2 who has relied on our island's public health system for years. I'm not a medical professional, but as someone who has experienced firsthand the challenges of accessing timely and specialized health care, I'm compelled to speak in strong support of Bill number 206-38 COR, introduced by Senator Telo Taitague, I'm sorry. This legislation aims to build a more diverse and sustainable healthcare workforce by expanding licensure pathways for qualified foreign medical graduates and establishing a local CONRAD 30J1 physician waiver program. Passing this bill is a critical step towards addressing Guam's severe physician shortages and ensuring better health outcomes for our families. Guam continues to face acute shortages of licensed physicians, particularly in the public health clinics and specialty fields like primary pediatric care and mental health, to name a few. These gaps have led to long wait times, overburdened facilities, and reduced access to high-quality care, especially for low-income, uninsured, and underserved populations. For instance, the U.S. as a whole is projected to face a shortage of up to 124,000 physicians by 2034, with rural and remote areas like Guam hit hardest. On our island, military medical facilities have seen declines in available visits due to staff shortages. And our public hospital, Guam Memorial Hospital Authority, struggles with limited professionals amid geographic challenges. As a result, many residents, including my own family, have had to travel off-island for specialized treatment, adding financial and emotional burdens. These issues are not just statistics. They affect real lives, from the elderly Manamco needing routine checkups to children in rural villages waiting for basic care. Bill 206-38 directly tackles these problems by modernizing our licensure system to better recognize foreign medical graduates who meet rigorous standards such as the ECFMG certification and equivalent international exams. By amending sections of Title 10 Guam Code Annotated, the bill ensures that qualified FMGs, many of whom are US trained and already licensed elsewhere, are not excluded due to outdated jurisdictional barriers. I'm sorry, my voice is falling. This will harmonize Guam's practices with national best standards, allowing the Guam Board of Medical Examiners to recruit from a broader pool of talent, while prioritizing placements in public facilities like GMHA, Department of Public Health and Social Services, clinics, and community health centers, et cetera, and that was a very good suggestion, Senator. The bill's emphasis on 3-year service commitments in underserved areas will help stabilize these critical services and improve access for Medicaid and Medicare patients. I would suggest changing the term to 5 years, but that's my take on it. Moreover, establishing a Guam-specific CONRAD 30J1 waiver program through DPHSS is a game changer. This federal program, which has proven effective nationwide, allows J1 visa physicians to waive their 2-year home residency requirement in exchange for 3 years of service in designated shortage areas. In other states, CONRAD 30 has bolstered physician workforces in underserved regions, increasing recruitment and retention of skilled doctors where they're needed most. For example, expansions of the program have directly increased the supply of international medical graduates in participating states, helping to fill gaps in primary care and specialties. Organizations like the Association of American Medical Colleges have endorsed similar expansions, noting that it addresses workforce shortages and enhances care in communities like ours. By implementing this in Guam, we can attract US-trained foreign medical graduates to serve in health professional shortage areas or medically underserved areas, directly benefiting low-income families and reducing the strain on our existing providers. On the flip side, there are valid concerns. The variability in international training might pose risks to care quality in our remote island setting, where resources for oversight are limited. The 3-year commitment under CONRAD 30 could lead to turnover, creating instability in public facilities, thus my suggestion to increase to 5-year term. Some argue this proposal shifts focus away from investing in local training programs for Guamanians. Alternatives like federal interested government agency waivers or non-waiver visas, for example, H-1B or O-1, exist, but they might not target our specific needs as directly. However, rebuttals address these well. The bill mandates strict credentialing, board-approved exams, language proficiency in English or Chamorro, and compliance monitoring with national data showing no widespread quality drops or ethical issues like brain drain. CONRAD 30 examples from states like Michigan and Texas demonstrate successful recruitment in rural areas without major displacement of US-trained doctors, and the program's flex slots allow adaptability. For Guam, this could complement local efforts, fostering a diverse workforce that sustains public services long-term. I also hear questions about whether foreign medical professionals are less trained or less professional. But as someone from Guam, I know many of us frequently fly to the Philippines for medical care, not because it's inferior, but due to its proximity, just 3.5 hours away, affordability and high quality services, especially in places like St. Luke's, which has partnered with Guam since at least 2023 to accept Medicaid and MIP patients, making specialized off-island care more accessible to our residents. In fact, the Philippines remains top medical tourism destination for Guam and Micronesia residents, with facilities like the Medical City, serving nearly 20,000 international patients annually, many from our region seeking treatments for chronic conditions unavailable or too costly here. If we trust them enough to seek care there, often for life-saving treatments, and rely on them in the U.S. system, bringing qualified ones here under strict rules, like those in the bill requiring the foreign graduates certification and board oversight, could only help our community by addressing shortages without sacrificing quality. Beyond their medical expertise, these foreign medical graduates bring economic benefits to Guam, including through the income taxes they pay on their U.S.-sourced earnings as J-1 visa holders, which are withheld and contribute to GovGuam revenues, helping fund public services like healthcare, education, and infrastructure. As high-earning professionals filling critical shortages, their tax contributions can boost the local revenue streams, where income taxes make about 60% of Guam's locally collected funds, ultimately reinvesting in our community to improve access for uninsured and underserved. For families without robust insurance options, like myself, and dependent on public care, this bill focus on priority placements in shortage areas could be transformative, enhancing Medicaid and Medicare services while building a resilient system. This bill offers a practical solution without compromising quality. Foreign medical graduates must still meet high credentialing and examination standards. Prioritizing public health placements ensures that the benefits flow to those who need them most, fostering a more resilient healthcare system for future generations. I urge you to pass Bill 206-38 without delay. This is an opportunity to invest in our people's health, leverage proven federal tools, and build a workforce that reflects Guam's diverse needs. Sidious Masi for your time and consideration. One more thing. Just a technical note I want to point out that I noticed. On page 5, line 12 and 13, relative to the credentials, diplomas, and others required documentation in a foreign language submitted by the board on behalf of applicants who are graduates of foreign medical school shall be accompanied by notarized English translations acceptable to the board. I would like to add shall be carrying apostille seal because we need to be in compliance of the Hague Convention for authenticating foreign issued documents. It's a reciprocity that we follow in the US as well. And that would be it. Thank you.
Thank you, Mrs. Mendiola. Director Arreola.
Thank you, Chairwoman Sabrina Salas Matanane, author of the bill, Senator Telo, Taitague, and senators of the 38th Guam Legislature. Thank you for this opportunity to provide testimony on Bill 206. Of course, relative to building a more diverse and sustainable healthcare workforce on Guam by expanding licensure pathways for foreign medical graduates and establishing a local CONRAD 30J1 physician waiver program. On behalf of the Department of Public Health and Social Service, I'm writing to express our support on the intent of Bill 206. Thank you for this opportunity. We recognize that critical need to address physician shortages and expand licensure pathways. However, the department encourages the fine author to wait on a piece of legislation that the governor's office will be transmitting to the legislature shortly. This forthcoming executive bill shares the same intent as Bill 206, but has been thoroughly vetted and guided by the Federation of State Medical Boards. It is important to note that this effort has been dedicated a 6-month effort involving collaboration not only between the Federation of the State Medical Board, but the Department of Public Health and Social Services, the Guam Memorial Hospital, the Guam Behavioral Health and Wellness Center, and the Guam Board of Medical Examiners and Officers. Furthermore, you may remember that the FSMB visited Guam just this past January 6th, and shared invaluable insight regarding best practices in other states and territories. By waiting for the governor's introduced legislation, we can ensure a unified approach that incorporates these expert recommendations and the collective input of our local medical leadership. While we'll differ on the upcoming executive proposal, public health remains committed to the core principles outlined in the current bill, including maintaining high standards, empowering local oversight, and prioritizing public health. Thank you for this partnership. Thank you for your partnership, Senator Telo, in strengthening Guam's healthcare workforce.
Thank you, Director Arreola. Dr. Shea?
Thank you very much. I know that Dennis has to go somewhere. You want to ask some questions before I start? Okay.
You can proceed.
All right. Good afternoon. Senator Taitague, Senator Talahi, Senator Matanane, Senator Ada, Senator Shawn Gumataotao, and new Senator Borja, correct? Yeah. I've been on Guam for 30 years. It's been a long journey, and I haven't got to, I guess what I'm trying to say here is that, I'm still around, and you can certainly have my phone number and tap me if there's any questions regarding healthcare and what has transformed Guam into over the last 3 decades. I think in this entire room, I probably have the most experience in medical practice in Guam. And I have gone through the medical educational process besides Dr. Thorpe here. So I think we are the experts in this entire bill. The CONRAD 30 waiver program, when I hear people talk about that you want to create that program exists. And let me tell you why it exists, because 10 years ago, I've gone through that CONRAD 30 program. If you recall, my associate, Dr. Song-Young Bae, who I recruited from Korea, has gone through the CONRAD 30 program. And she stayed with me for about 3 years. And Attorney Nelson Su, XU, is an excellent attorney in immigration. And I'm sure Attorney Tulahi knows him as well, and many of us do. The CONRAD program exists. It's not like we're creating a new program, just so that everybody here understands what's going on. And I wish I had my slides up, because I can better talk about, so the public can better understand what I'm talking about, rather than just looking at me on TV. But be it as it may, I'm glad that Senator Taitague actually introduced this bill. I've been looking forward to have input in the bill and help you craft it so that we can have more foreign qualified graduates to come to Guam and assist us. So that's what I'm here today, is to make sure that you understand that I'm not opposing the bill, but I think what we need to do is work on it together and tap into those sources that exist in Guam. And I will go through some of the facts from the Federation of Medical Boards. It's not coming from me, but recommendations from the Federation of Medical Boards. Besides just testimony basing, we support this bill, the intent is good, etc. So I'd like to present that and go through it. But the CONRAD 30 program, I know it very well. I've gone through it. It's a long process, a tedious process, and yes, now they added $100,000 to each of the applications, and that may exist for the next couple of years, but it takes a long process. The difference between the CONRAD 30 program and what you're doing with this particular legislation is that the candidate who I recruited 10 years ago, gone through the CONRAD 30 program, but is trained in the United States. And the CONRAD 30 program requires, in fact, if you read the CONRAD 30, in fact, I have a CONRAD waiver program directly from the U.S. immigration with me, and so I'm not just saying on top of my head, is that it requires medical graduate that's trained here in the United States, not a foreign trained graduate. It's trained in the United States, but they are required, once they finish their residency training, they are required to go back to their home country for 2 years. But the CONRAD 30 waiver program transforms the J1 visa waiver to a CONRAD 30. CONRAD 30, once approved, you apply for the H-1B program. And that's how it processes through. So it's not like a foreign program where you can go to a foreign country, you train, and you come back through the CONRAD 30 program. That's not how immigration works. But be as it may, I wanted to also bring up the fact that in order for the bill to be supported, it must include the entire island. I don't know why GovGuam always excludes the private sector. I mean, we're part of the healthcare system, aren't we? As a matter of fact, I think the private clinics out here in the community provides probably the most care through the entire community. And I think you should tap into those resources. And that's one of the recommendations, that the resources that exist, but you have to include the private sector into whatever legislation that you have. Don't exclude the private sector. We're your partners. We're not here against GovGuam, even though I do criticize GovGuam often. But putting those differences aside, we'll rise up to help. But everybody's got one of these. That's my slide set, right? Okay. Let me just go forward with that. So just to introduce myself, my name is Dr. Thomas Shea, and I'm a board certified by the American Board of OBGYN. I'm also a fellow of the American College, and I'm also an associate professor of the University of Hawaii School of Medicine, John A. Burns. I'm also an adjunct professor for New York School of Medicine at IT. I'm also a clinical preceptor for a PA school in Virginia. I'm also a United States Navy veteran, and I practiced at the Naval Hospital 4 years on my active duty here. And I've been on Guam for 30 years. Next page. The next page is basically showing the basic bill in itself. And it says, relative to building a diverse, sustainable healthcare. In order to be diverse, we have to be inclusive and not exclusive. When you talk about exclusivity to GovGuam or TOTU or public health, those are exclusivities. And that's not going to help patient access. That's going to make it even more difficult, because the experts really are often in the private sector, especially if you're looking for supervisory roles, because when you have candidates coming in, they're going to have to be sponsored by experts. And the experts reside in the private community, not necessarily in government system. Next slide. Now, without nurses, doctors really can't practice, really, We need to consider nurses too. So if I would add an amendment to this bill, I would include the nurses, the foreign nurses, Senator Taitague. And I think you have the opportunity here to actually engage the Guam Nursing Board to say, hey, because within this bill, you talk about waiver of examinations, for the U.S. examinations, which currently, if you look at, can the foreign nurses work in the United States? They must pass a U.S. administered standard of the NCLEX. So we all can agree that we always talked about, even during the senator here, that not foreign nurses, but we are shortage of nurses in the United States, maybe even worse than the physicians, especially on Guam. We're always struggling in the private sector and also in the public sector. Just to give you an example, I have one doctor in my office, solo practice, and I have 7 nurses supporting me. So if you recruit one doctor to Guam, you may want to recruit at least 5 to 7 nurses to Guam. So I think there's an opportunity here to include the foreign nurses, and perhaps if you're going to waive the USMLE or US examination, certainly if you're going to do it at our level, you can certainly waive that as well. Next page. Now, based on the nursing board or for foreign nurses, there's 2 things that stood out to me. And one, again, is the NCLEX exam. Well, if you want to waive the examination for the US, you can certainly waive the examination for the NCLEX. English proficiency is one. Of course, English is actually my second language. I'm sure you probably noticed that. Chinese is actually my first language. I wasn't born in the United States. I immigrated here with my mom when I was about 10 years old, so I had to learn English. You can probably hear my accent now, right, when I brought it up. But English should be proficient. That's one of the nursing examinations, too. Next page. And the third thing is that they must apply, like any other graduate nurses, through the credential checks before they can take the NCLEX. But within the bill, you're trying to structure it so that they can bypass those credentialing checks. You can create your own checks. So why not create our own checks for nurses? We certainly can. You want to hold the doctors to certain standards, but you also want to make sure the nurses have their own standards too, so we can actually create those system checks and balances. Now, next page. The authorization, again, the NCLEX. So if you can waive a USMLE exam, the national boards that's administered in the United States, then you certainly can seek to waive that exam. If you can waive that exam, I bet you we will not have a foreign, we have a lot of foreign nurses that can come to Guam. Next slide. So focusing on this particular bill here, and I think it's a good start. There's 3 national organizations that put out its recommendation. And I think the public health director I mentioned, they work with the Federation of State Medical Boards. Well, in addition to the state medical boards worked with 2 other organizations. And one of them is called the Accreditation Council for Continuing Medical Education. I know Dr. Thorpe knows that organization very well. It is an accreditation organization that accredits medical schools, accredits residencies, accredits training programs. Within that, the Federation of Medical Boards looks up to them to see what training and what criteria, including how foreign graduates should come into the United States. The safeguards are there. Plus another nonprofit organization, I think Intel, I think they're nonprofit. So they produce a set of recommendations. And I have it in my slide. Actually, it looks bigger if you blow it up. There are key recommendations to go through here. And I'll go through just briefly. But in order to go through the entire recommendation, they actually put out an entire paper. And it just came out 2025 in August. So this is very recent. And the reason I have it, I didn't even know the bill was introduced. And I wish Senator Taitague had called me. I would have sat down with her or any of you in the committee and gone through it and helped you craft the bill. But be as it may, I'm here. And I make myself accessible. Next page. So the first recommendation is assessment. Assessment. So you don't just leave it to the board to decide. I have comments on the makeup of the board too. But the assessment, the recommendation, so there's 6 general competencies that you have to look at. Patient care, procedural skills, medical knowledge, practice-based learning and improvement, interpersonal and communication skills, professionalism, and system-based practice. Those are ones that they recommend that we must follow. The second one, ITP should undergo formative needs assessment. ITP is not thrombocytopenia, okay? ITP means International Trained Practitioner or Physicians. And basically they're saying that they need to go through a supervisory period. And which CONRAD 30 basically states that they should by the sponsoring entity. So, but they have a lot of good recommendations that how that supervisory period should be carried out. It's not like you hire them to go to public health and just go ahead and practice and see patients. You can't do that. You need to put them under a supervisory role. Next, 5. By the end of the supervisory period, they can practice unsupervised in the general competency areas. Now, as far as supervisors goes, okay, they make specific recommendations regarding the competence. Next page. Under 7, when you take a look at who qualifies for supervisory role, they require that to have especially board certification. They want you to be board certified so that you can serve as a supervisor for that particular candidate. Now in 8, if you look at that trial period or supervisory period, they also talked about details, and I have that. You can ask me questions on that later. But next page. In conclusion of their recommendations is that currently, nationally, they don't have a centralized system regarding assessment. They don't. So they recommend that we tap into existing resources which offer potential opportunities. And that's what I'm saying to Senator Taitague, is that we are your local resources. The private clinics are your local resource. We are board certified. I know I am. Are you board certified? Yeah, Dr. Thori board certified. So, so we are your existing resources. And before I head down to the sunset in another 30 years, use me. Use me to help you to make Guam a better place for healthcare. And that's my mission over the last 3 decades. Next page. All right. So this one is just one big slide that says existing resources. Again, we're in the private sector. And you got to use us, because to exclude the private sector is like you're going to blindly lead the blind. We know how to practice medicine, and that's why we're successful in our private practice. So you shouldn't exclude the private sector in this. You got to include them. Regardless of profit or nonprofit, it doesn't matter, because I can tell you the truth right now. The truth can be offensive, okay? Nonprofit clinics, quote unquote nonprofit clinics, at the end of the day, they're running like it's for profit, okay? If you talk to patients, at the end of the day, it's almost like it's for profit. Now, next page. If you go page 1 of the bill, if you turn to page 1 of the bill, I'm going to just go through this bill. There's about 8 pages here. The intent of the bill is actually good, but I think the intent can be expanded, right? Because the intent is not just the public hospital, it's not just community health centers, it's not just Totu Guam, it's not just the nonprofit clinics, basically. It's the entire island, right? Because you want to make sure that quality of care doesn't just apply, or access to care doesn't just apply to the private clinics only or public health. You want to be inclusive and not exclusive. So I think what we should do is strike out all this, quote, priority for access, Guam Hospital, nonprofit clinic. You should open up to the entire island. If we can recruit more foreign doctors to Guam, why not? Why limit it to only the public sector and the nonprofits? Well, why? Because that's an open question. Because anyway, again, I think also the intent can include nurses as well. Next page. On the page 2 of the bill, the legislature over the last several years also has been critical of the Guam Board of Medical Examiners. But within the bill, it provides the same board that the senators so criticized over and over again regarding the timeliness of addressing patient complaints, investigative authorities, the lack of oversight. But you're giving this board the ultimate powers like God, that you can allow them to determine all this stuff that, hey, whatever the board determines is good. But yet we criticize the board for their lack of better words. I can't say it, but the problem with the board needs to be revamped, okay? We got to change the composition of the board, perhaps. I know the Organic Act allows the governor to appoint the board members. Then again, is that board member serving at the pleasure of the governor or the people who appointed that person to the board? Guam is small, and we hear things within the medical community. The influential powers of Adelup or senators, former senators, may call the board and say, hey, I need this person licensed. And certain board members may say, man, they talk to us about it, what do you think, etc. On the side or curbside consults, as we call it. We say, that's a risky proposition there to license a provider because it may cause harm in the community that you may not be able to control. But then again, one call, two calls, the inner works of these politics that the person gets licensed. And then a year, 2 years later, you discover, whoa, what happened? This person committed malpractice or this person committed that. And then we look back and we say, we told you so. Oh, but. So those things occur. So I think we need to take a step back. Before you provide the Guam board with so much powers, especially on Guam, we have to be cognizant of the influential powers of the appointments by the authorities, okay? I'm just telling you the truth, and that's just the facts. Next page. I'm still on page 2. Again, it addresses here that prioritizing placement. I would strike that out. I think placement is good, but I would strike out prioritizing specifically the GMH, public health, other Guam facilities. I would even put nonprofits. I would just open it up to the entire island of Guam. Because access to care should be for everybody. It should be for everybody. In fact, I can tell you right now, as far as the shortage of OBGYN goes, Guam Memorial Hospital has probably got more OBGYNs now than the community has. On Guam, how many board-certified OBGYNs do you have in private practice, in the private clinics? Just 2. Myself, SDA, that's it. A GMH, they have, I think, 4. So you got to include the private sector because, there's 2 of us here, right? And if I go off island, you live at 1. If 2 of us goes off island, we live at 0. That's a problem. And that's in the private sector. Next page. Page 3. It goes from page 3 to the bottom of page 4, but I'll start with the page 3 here, the bottom of page 3. Here's a section that proposes to waive the usual licensing requirements for a candidate. Again, it should include the nurses. You can do it. I know you can, because we need nurses. Seriously, we do. Currently, all U.S.-trained graduates must complete a minimum of 3 years progressive medical. That's already in the bill, but now you want to waiver this section. So just look at that carefully. We can talk about it some more later on here. Next page. Page 4 of the bill, under section 4A, it says you're giving the Guam board the authority to say, hey, a board approved equivalency. Again, I already gave you my opinion of, I shared your opinion about Guam board, the politics that it involves, and the external influences of licensures, etc. So we have to be real careful with the powers that you provide that. I'd rather have things written in concrete rather than giving it at the discretion of the board who is appointed by politicians. We should base it on the qualifications, really. Next page. Page 4, continuing on again, he says here, the section D, he says equivalency to, ECFMG, and then the foreign graduate examinations and training. When you talk about the Educational Commission for Foreign Medical Graduates, what is equivalent to that? You're looking at the board's, discretion to that. It's unclear, and I'm sure Dr. Thorpe can talk more about that. And the requirement is either English or Chamorro. Now, granted, Chamorro is the, the language here as well. So is Japanese, so is Filipino, so is Chinese, Micronesian. So I think we can all say that English should be the main language proficiency that needs to be passed. And not just, you can be multilingual, which is great, but, not either or. Next page. Again, another section that's relying on the board to do all this, I read in the paper sometimes, you guys talk about the pari-pari system. Is that right? Am I saying it right? The pari-pari, I don't even know what that means. But I assume that means that, you owe somebody a favor, or you do this, or I appointed you to that position because, I want you to do things for me, etc. Those influential powers exist on Guam, and we all seen it, we all heard it. So you have to be very careful the powers that you place on these board members. Next page. On page 5 of the bill, on the bottom, again, you're putting a priority for access to foreign graduates. It's discriminatory. And to me, I think it's discriminatory. It doesn't do justice to the patients for Guam. It really doesn't. Yeah. I'm sure some senators here, or maybe in the past, may thought, well, Dr. Shea is against this bill because he doesn't like foreign graduates because it's going to go against his own clinic competition. It's not that point. I'm at 30 years of my practice. I can retire, but I'm still here because I care. And I want to help Guam. If you want to do foreign graduates, let's work at it together. But don't include just the Guam side. You got to include the private sector, please. All right, next page. Page 6. Now, this is one particular part here that I think is kind of odd that can be removed. As far as the employment agreement goes, under the federal law, under the the CONRAD 30 waiver system, the contracts is provided to the immigration, provided to the federal government. But if you're in the private sector employment contracts, you're going to give it to the Guam board. It doesn't make sense. Like I said, the Guam is so small. What is the private contract got to do with the Guam board? Why would they care about that? It doesn't make sense. MOM agreement, memorandum of understanding, that doesn't make sense either, because if you're going to go through the CONRAD 30 program, those things are set. Its rules are set. I can't change those rules. Those are laws that are already set to go through the visa program, and they have their own criteria of what needs to be included in these contracts. So I think those things should be kept confidential. Now, the minimum 3-year deal here, really that's already in the law too, because going through the CONRAD 30 program, it is a minimum of 3 years. You got to be 3 years. But after 3 years is done, you can provide that green card to the candidate, and the candidate has the freedom to go elsewhere. And most of the candidates that come to rural areas will take that visa and they would leave. They usually don't stay. Like my candidate. Yeah. And for good reasons. I don't blame her for not wanting to stay. And we don't hold people back. We don't, this is not slavery or anything like that. Certainly, it's still going to be a revolving door. Next page. Page 6. Page 6, again, talks about certain rules of the CONRAD 30 program, but I already explained, those rules are already set in stone. We really can't, and it doesn't make sense there. On page 7, licensure without examination. This is the important part, because you're giving the board the authority to endorse candidates. Basically, it says there, without examination. But if you read through the bill from 11 to 25, it talks about examinations. But then the title there, it says here, license them without examination. So if you're going to license them without any examination or license them through an exam that the Guam board creates, it's got to be specialty specific. Specific exam, internal medicine, OBGYN, surgery, pediatricians, those are examination specific. And I think dentists have one of those, but I'm not quite sure. But if you're going to waive that, you got to include the Guam nurses. If you can waive examination for a doctor who gives nurses orders to give injections, to give nurses orders to provide the medication to the patients, and you're waiving the doctor's examinations, you can certainly waive the nurse's examination, the NCLEX. So I would encourage you to look at that, work on it, and we can get us more nurses from the foreign countries. Next page. I think I'm on the last page here. Again, this last page is just basically talks about one of the licensing options here, but it doesn't make sense in the last page. Let me tell you why. Previously on page 6 or 7, it talks about the 3-year limit, correct? You talk about you're going to waive the examination, and then here you're talking about specific, it says here, board author require applicant to fulfill unrestricted medical license who have not been formally tested. So you're going to give them a license who has not been formally tested by a United States or Canadian medical jurisdiction comparable medical, international medical exam, a board-approved medical certifying agency or a board-approved medical specialty within a specific time frame before the application. So you're going to give them coming in with no examination, but if you want to require them to take it, they have 8 to 10 years to pass it. Well, 3 years is up. I mean, don't you want to require them to pass it within 3 years? Because by the time they'll be practicing for 3 years without even passing an exam. So that 8 to 10 years doesn't make much sense there. And I think Public Health Director said there's another bill that's coming forward. I'm sure Ada Lube is listening, so they're probably hearing this testimony. But I'm glad Senator Taitague bill came first, so you got the input that I have just provided. But again, I've been through the CONRAD 30 program, and it is not new. It exists. You know what the reason for it? You know why they call it a CONRAD 30? Anybody know? I didn't know until I went through a CONRAD 30. Each state and territory has 30 spots, 30, under the CONRAD 30 program. 10 of those spots can be flexible to be addressed, maybe physician, researcher, etc. But it's because each state and territory is allocated 30 spots. That's where the term CONRAD 30 comes from. So I hope I brought some light to the bill, and I'm sure Senator Taitague is going to make improvements, and I'm always available to discuss and help Guam improve health care. Thank you.
Thank you, Dr. Shea. Dr. Thorpe?
Hafa and good afternoon. Thank you for the opportunity today to speak. My name is Jonathan Thorpe. I'm an internal medicine physician and the medical director for the Guam Seventh-day Adventist Clinic. And I want to thank you again for the opportunity to testify on Bill 206. I testify today in support of the intent of the bill with significant recommended modifications for your consideration. Guam's physician shortage is real. I know it because I work on recruiting almost every day. In fact, I had 3 interviews with physicians. It's really hard to get people here. I understand the issue very much. And I truly want to be part of the solution. I commend Senator Taitague for advancing this conversation and for bringing this proposed legislation forward. I think I also bring a unique perspective, having lived and worked in a number of different countries, specifically with foreign medical grads, and many of who were EFMG certified. I've written letters of recommendations for them for training programs in the United States. I've lived and worked in Malawi, Nigeria, Tanzania, Lesotho, and for the longest duration in the country of Nepal. And I truly met and worked with some incredible physicians. I mean, really amazing people. And at the same time, I've worked with others that raised some significant concerns for competency and patient safety. And that range is exactly why the standards we set in this bill are so vitally important and really matter. Good intentions do not protect patients. So 3 points, just briefly for your consideration. First is the postgraduate training requirement. As written in Section 4, there's the changes to the 36-month postgraduate training requirement from mandatory discretionary for foreign medical graduates. I frankly, candidly hesitate to support this, and I'm looking forward to seeing the forthcoming legislation that was alluded to from the governor's office, but as been mentioned in February 2025, the Federation of State Medical Boards, ACGME, which is the Accreditation Council for Graduate Medical Education, and Inteleth released consensus recommendations stating that the completion of postgraduate training should be required for alternative pathway eligibility. Not necessarily in the United States, but it must occur somewhere. I suggest that if we accept training completed abroad, we must define locations where we'll accept training to occur at. For example, nations such as United Kingdom, European Union member states, Australia, Japan, Turkey, the Philippines maintain rigorous standards for postgraduate training and could serve as a starting point and open-ended acceptance of training from any country. Without postgraduate qualification, I believe truly undermines the very safeguards this bill should provide. And so I urge the committee to align with the FSMB framework rather than move against national guidance. Secondly, competency assessment. Having personally gone through the licensing process, I can attest to the knowledge that is acquired in these different exams. The ECFMG is a competency assessment primarily of medical knowledge as measured by the United States Medical Licensing Exam Steps 1 and 2. Step 1 is primarily an exam focused on basic science and basic clinical science, and Step 2 is focused on the very, very basics of clinical care. But it does not measure competencies around the ACGME core competencies of patient care, medical knowledge, practice-based learning and improvement, interpersonal and communication skills, professionalism, and system-based practice. And I would suggest a structured provisional period with supervision and competency evaluation would create a pathway that is both welcoming to qualified physicians and protective of our community. Senator Taitague, you mentioned the BMG study, and I haven't read that study personally, but it was an interesting comment you make, and I would respectfully just point out that these outcomes were in FMGs who were functioning in training programs in the United States hospital systems where they were immersed in the 6 competencies of care that ACGME trains around and measures against. Third is parity, as I've been alluded to several times today. This bill directs foreign medical graduates to prioritize practice at public facilities, and I believe that the people of Guam deserve the same standard of care whether they enter a public clinic or a private clinic. If a physician is qualified, they should be eligible to serve anywhere. If they're not yet fully qualified, they should not practice independently anywhere. Equal standards, equal access for patients and providers alike. So in summary, I support alternative licensing pathways and the CONRAD 30 program, but I urge this committee to retain a postgraduate training requirement consistent with FSMB guidance, incorporate the competency-based assessment around the ACGME pillars, and ensure parity across all healthcare delivery sites. I'm very ready to work with this committee, the Board of Medical Examiners, and Department of Public Health and Social Services to be part of the conversation to build a framework that can improve access to high-quality, safe care that serves the diverse needs of this island. Thank you for your time.
Thank you, Dr. Thorpe. For the public that's watching and those of you who are in the audience, we did extend invitations to the Guam Board of Medical Examiners, the Guam Memorial Hospital Authority, as well as the Guam Behavioral Health and Wellness Center to provide testimony. And as the start of this hearing, we did not receive any on Bill 206. We did receive testimony from David Lubofsky. We were expecting him to come in on Zoom, but he is not able to. He did request that we read his testimony into the record. So, do you want me to read it? And Senator Terlahi I will read it into the record. Hafaday, Madam Chair and Honorable Senators, thank you for allowing me to give testimony. My name is David Lubofsky. I'm here to support Bill 20638 with urgency to save lives. Guam's healthcare system is not just strained, it is failing our people for many reasons, but most obviously because attempts to modernize our medical licensure laws and bring qualified foreign-trained physicians to Guam has been blocked for years by the same group of individuals who have also fought to weaken medical negligence accountability. That is not a coincidence. That is a pattern. In the 34th Guam Legislature, Senator Dennis Rodriguez Jr. introduced Bill 12534 and Bill 12634, both designed to expand access to qualified foreign-trained physicians. These bills would have addressed shortages and aligned Guam with the rest of the United States. And what happened? They were met with fierce resistance. One doctor even said publicly in the Guam Daily Post, quote, "If they are going to let foreign doctors practice here on Guam, then will I be able to practice in the Philippines or in Japan," end quote. That was the argument, not safety, not standards, not the needs of the people of Guam, not the needs of GMH. He focused on reciprocity, competition, turf, and self-interests over the interests of the people of Guam and ignoring the largest maternity death rate in the country. And speaking of turf, it is really a coincidence that Guam has the least malpractice accountability in the country, which even allows doctors to work outside of their fields and earn more on procedures they otherwise would not be able to do, while at the same time, Guam has no functioning CONRAD 30 program pathway to bring foreign doctors to the island. This is not a coincidence. This is a system designed to keep competition out and keep accountability down. We see the consequences every day. GMH is understaffed, clinics are overwhelmed, mothers cannot find OB/GYNs, and families are forced to fly off island for care if they can afford it, but most cannot. Before I go further, I want to say this clearly. Guam has great doctors. I have one of the smartest and most caring family doctors in my life. My eye doctor is outstanding. My dentist is excellent. But we do not have enough specialists. That is why I'm sitting here today in the Philippines receiving specialist follow-up care that rivals anything at Queens MC in Hawaii, Good Samaritan, or Cedars-Sinai in Los Angeles. Hospitals where I have personal and family experiences myself. I know the level of care they provide because I have lived it. And I can tell you, the specialists and doctors at St. Luke's or other facilities are every bit as capable. With the passage of Bill 20638, the poorest and most disadvantaged patients on Guam will finally be able to access life-saving care right on island, similarly to what we get in the Philippines or the States. Bill 20638 modernizes our licensure law so that foreign medical graduates who meet rigorous, verifiable standards can practice on Guam. From what I understand, all 50 states operate a CONRAD 30 program. Guam is one of the only jurisdictions that has never fully implemented this proven federal tool. Bill 20638 finally gives Guam a functioning CONRAD 30 program. It will save lives. The Guam Board of Medical Examiners knows the system is broken. They know the shortages are dangerous, but without legislative authority, they cannot act. Bill 20638 gives them that authority and removes the excuses that have protected the status quo for far too long. Bill 20638 will also help to reduce concerns about medical negligence or medical apathy that has taken the lives of our children and loved ones. When you increase the number of qualified providers, you increase competition, and competition always improves the quality of care. This also lessens the need for providers to work outside of their area of expertise due to a lack of a doctor in the needed area. This bill is not about politics. It is not about protecting turf. It is about the people of Guam who have waited for far too long for a functioning healthcare system. It is about mothers who cannot find an OB/GYN and families who cannot get timely care. It is about a hospital that has been stretched to the breaking point. Bill 20638 is a prescription for justice. It is long overdue. I urge you to pass this bill without delay. Sizu Ismaasi, David Lubofsky, ED.D. We will now open the floor for questions, and we will begin with the author, Senator Taitague.
Thank you, Madam Chair. Madam Chair, I could go last and also do my closing. I'll allow my colleagues to ask questions. Thank you.
Senator Borja?
Thank you, Madam Chair. I don't necessarily have any questions. Definitely a lot of information to look into. I do have some concerns in regards to whether or not, this would be like a gateway to like foreign doctors coming to using Guam as a place to come and get licensed and then go to other jurisdictions. And so we'll continue to, work with the committee and but that's just one of the concerns I have. But no question. Thank you for coming down today. Thank you, Madam Chair.
Thank you, Senator Borja. Senator Gumataotao?
Yes, thank you, Madam Chair. And I only have two questions, but if Teresa, I don't know if I can ask you to just come back up. I just wanted to ask this of you, and then I can ask the doctors the second question. And if you're able to answer, it would be great. For the benefit of those who are following today's discussion, what information can be shared regarding the number of foreign-trained physicians who have met the medical residency requirement in the U.S. who are currently employed in Guam's public hospitals or clinics? I don't know if you can answer that. And is there any information available confirming whether complaints have been filed involving any of the work of these physicians?
Senator, yeah, I'm not able to answer that right now. I don't have the information, but I'll definitely look into it.
Yes, and if you can
get it to
to the committee would be good.
Committee.
I'm just wanting to get that from your perch,
Sure.
especially in the role that you have. And if I can, for the doctors that are remaining, recognizing anecdotally that a number of Guam's residents continue to seek medical care at foreign medical facilities that are authorized through their respective health insurance providers here locally, to what extent do health insurance companies consider U.S. licensure requirements in their selection of foreign doctors to provide care to their respective subscribers?
I can tell you that I refer my patients to St. Luke's to get medical care almost every week. And the reason I was able to do that is because I work with the St. Luke's Medical Center at Global City very closely. I personally meet and I talk to the specialist that's there. I know their credentials. It's almost like a supervisory role that I provide for my patients because I don't want to refer my patient to someone that I don't think is competent to take care of. It's just irresponsible for me to do. But every week that I refer patients out of Guam to get care. And even if the governor says, we're going to build a hospital, okay, here I go again. Truth will be offensive, okay? Even if we build a hospital, it doesn't mean that you don't have to leave Guam to get care. Even if we build a hospital and you have specialists here, you're going to have to leave Guam for a certain type of medical care.
Okay, Dr. May, but let me go back to the licensure side.
Yes, I'm getting to that.
Can you help me with that?
Yeah. As far as licensure side, I do not think the insurance companies require them to have licensure in the United States. But I think what the insurance company does is that I think all of them, the private ones at least, have offices inside St. Luke's themselves. And I'm focusing on St. Luke's because that's the most traveled to the Philippines. There's also Taiwan as well. There's also Japan. And I think Korea is also part of a network as well, international network. But I don't think it requires them to be U.S. licensed. But then again, we have to be careful on who you send your patients to and who the insurances will cover. They have to go through a credentialing process as well. Credentialing and licensure is a little different.
All right, thank you. Doc.
Thank you, Senator Gumataotao. As I mentioned in the testimony that I've shared, is that I am supportive of a pathway for physicians that have been trained in these countries to work here in Guam. And I've also seen firsthand some amazing physicians. I've worked side by side with them in the ICUs and on the floor in the ER and have really been in awe of their care, quality in their work. My concern as the bill is written is that the definition of allowing for the application to start the process is just be a graduate from a World Medical School and an ECFMG has been cleared through that process, as I understand it. So the issue is more practice-based competency, and so there needs to be some way to assess that practice-based competency to make sure that we're getting the right people here. But I fully support bringing in the right people.
Okay, no, and I appreciate that. I'm just trying to understand more about these health insurance companies and how that they go about that process. I'm just trying to get some more insight. I understand the other parts of the bill, but I'm trying to understand when all of the providers, some who provide, I guess call them services to our branch of government, to our sister branch of the judiciary, the executive branch, to the private sector. I'm just trying to understand what's going through their minds, or what's part of that process for them. That's what I was at.
Sure. I mean, I don't sit on the credentialing panel for the health insurers, but I would suspect that they're looking at outcomes-based data from those large centers to determine whether or not they're going to provide coverage. And they're not, like, as the patients I've sent to the Philippines or other Pacific Rim Asian countries, it hasn't been to any hospital in Asia. It's to the big multinational, international hospitals that are there, and I would assume they're looking at outcomes-based data to determine whether or not they're going to provide coverage at those facilities.
All right, thank you, Doc, and thank you, Madam Chair, for the time to ask questions today. Thank you.
Thank you, Senator Gumataotao. Vice Speaker?
Thank you, Madam Chair. I don't have any questions, but I just hope that when the bill goes up for a markup with the committee, that we invite these folks in so that we can continue to have input and make this a stronger piece of legislation for a win-win for all, not just the medical doctors, but also for the people of Guam, most especially the people of Guam. I think it's become a long time in the making, and now we need to see how we can improve our healthcare.
I agree. This is not just, it's not for us.
Yes.
Really, the ultimate goal for this whole bill and the idea is to increase access to care for everybody, every individual. It doesn't matter if you're rich, doesn't matter if you're poor, doesn't matter if you're white, brown, yellow, red. It should not matter. It should not matter. Access to healthcare should be for everybody. And if we're going to change the status of foreign practitioners coming in, it should be accessible to everybody.
Yeah, definitely. Thank you, Doc. Thank you, Madam Chair.
Thank you, Vice Speaker. Senator Turlai?
Thank you, Madam Chair. Thank you all for your testimony. I'm not going to pretend that I totally understand all of this, but so please bear with me. Just want to make sure. So Mr. Lebowski says that all 50 states operate a CONRAD 30 program. Guam's the only jurisdiction that has never fully implemented this proven federal tool. Do all of you agree to that statement?
No. In fact, I just messaged my attorney, immigration attorney, Nelson Hsu, who's that's all he does is immigration. And he says, yes, CONRAD 30 does apply to Guam. And I've gone through it 10 years ago.
So when you went through it, that was for a person to practice on Guam?
Yes. In fact, when I went through it, it got the endorsement of public health.
Yeah, if I could have public health, please come up here to answer that. Have you licensed attorneys? Oh.
If I may, just a point of information, if I may, Madam Chair. So the J1 visa waiver is a one animal all in itself. Okay. What CONRAD 30 does is what you said earlier. CONRAD 30, which was named after a senator that knew the importance of these areas, underserved areas, allowed, because in the J1, you serve for a time, and then you have to leave and then serve in the country you came for 2 years. Now, adding CONRAD 30 to the J1 visa program, what that does is it allows the individual, instead of going back, to stay in the U.S. and work for 3 years, as long as it's in an underserved location. So it is two different separate things. J1 is a visa waiver to work, and then the CONRAD is added on top of it to allow them to stay instead of how to return. Just a point of information. Okay.
Yeah, that is correct. But you start with a J1, and the whole point of the CONRAD 30 program It goes from J1, it goes through, J1's here, it goes through CONRAD 30. From CONRAD 30, it goes to HB1 visa. And that is the process that you have to go through. You can't go CONRAD 30. This is a specific program for J1s to go through. Yeah. Now, if we talk about, it's even a better program, Senator, is talking about the nurses. Remember I said the nurses should be included? They don't have to. There's no CONRAD 30 for nurses. It's even better because nurses go through direct through a specific program.
The BON, yes.
Yeah, they go to directly to, as long as they have an employment contract, they can go direct to a specific called the EB3. And if an EB3, go H1B visa program, if I'm using the correct terms. So it's even easier for you to get foreign nurses if you can waive the NCLEX. So if you can waive the examination for physicians, I personally don't think you should, but I mean, we got to take the board somehow. But if not, how are you going to ensure competency? But if you can do that for physicians, certainly I think nurses should be waived. And if you didn't do that, you solve your nursing problem.
All right, if Public Health can confirm, do you know?
Senator Chalai, can you repeat your question?
When you do licensing, do you know whether they are J1 visa status or CONRAD 30? And do you know if there are any on Guam that are CONRAD 30?
Please identify yourself.
Of course. Brianna Sablon, the Acting Administrator out of the Health Professional Licensing Office with the Department of Public Health and Social Services. For the J1 visa, I don't have the count, but there are some during the administration of Director San Agustin, previous director that we did process. There is a current J1 visa process with the department, and it's solely handled by the director's office. So that would be dealt with the attorney along the documentation or application will be submitted to the director's office. They take a look at all of that. There are some times where we're not aware of it, but when it does come in for licensure, then that's where we would start tracking. But as far as the CONRAD program, I'm not aware of it, only the J1 visa.
All right. And then, go ahead. Sorry.
Yeah,
Senator Rodriguez.
Yes, sorry, and Speaker, so I know also that Guam does, has a program that public health manages, but I think what's lacking is that it's not recognized in statute, and there's no mechanism. And I think that's what this the bill is set out to do, is to put in statute and then have public health put out a mechanism in place to, as she just had testified, it's a program there, but there's no mechanism. And I think this is what this bill sets out to do.
All right. I disagree with that because, no matter what statute you create, even Senator Taitague said that it's not to change federal law. The CONRAD 30 program, J1 visa program, is already in statute in the feds. We can't change it. The law is there. You just have to have an attorney to go through it. And I've done it. I have proof.
Well, it looks like to me the bill's trying to mandate that the Department of Public Health and Social Services is designated as the state equivalent health agency authorized to administer Guam's CONRAD 30 J1 physician waiver program pursuant to federal law. So this is done in other areas where we have to designate a state agency to administer that. Is that your understanding, Public Health?
That's correct.
All right. And then this would bring
it's not. You don't have to statute as designated public health. Public health
we don't
is
have
already
to.
there because under the J1 and CONRAD 30 program, it requires public health to provide a letter to immigration in order to go through it. It's not like we have to designate. They're already designated. Public health is already the area where we need to get endorsement to say, hey, we want to bring in a J1 visa candidate. So we need your endorsement to say, hey, we are short, and they have to give you a letter. Is it redundant? That's what I'm saying.
Well, this looks like what might be right now going through the Director of Public Health is going to be after this, if this bill's passed, require the Guam Board of Medical Examiners input. That's the difference. Is that correct?
No. The Guam Board of Examiner input is separate from the visa program. They have nothing to do with the Guam Board of Medical Examiners. The Board of Medical Examiners strictly is based on licensure of the candidate.
That's current, right? But the
Yes.
bill on page 6, section 5, gives them a role. And so I guess, yeah, I'd like to study that further. But so then we go back to the other source of disagreement is that, I mean, so Dr. Sher, you're saying we don't need any change in our statute. We're already
Not on the
allowed to
CONRAD
do
30
this. So
program.
why do we need
No, not on the
to-
CONRAD 30 program
Okay.
and the visa waiver status. That part, I already said, it's already redundant. What I'm saying is that if you're going to allow foreign graduates to come in, the Guam Board of Examiners, you have to be careful with. And that is where you got to make sure that the licensure, the double checking what Dr. Thorpe has mentioned, the foreign graduate examination, those are the things that got to go through the board. As far as the visa waivers, as far as the CONRAD 30, those are set. You can't change that. And public health is already designated within the CONRAD 30 system that each state's public health has to issue an endorsement saying, hey, this is what when I got applied, in a committee, if you invite me in, I'll bring in our original application. I'll even have my attorney to come in and talk to you about it, about the CONRAD 30 program. But I think what you need to address here is the concern that we brought up regarding the licensure. You're giving the board a lot of authority.
Yes.
You got to be careful with that.
All right, I'll address that soon. So going back to it says CONRAD 30 J1 Physician Waiver Program. Senator Rodriguez, do you agree that this is the difference, is that it's now involving the Guam Board of Medical Examiners, where right now we might have only the Director of Public Health making a finding?
Yes, I agree in that. And also, it also addresses issues like the federal law, and some of the doctors had mentioned that private clinics could avail of this as well. However, the federal law makes it very clear. This is about access. If the private clinic provides access to the underserved, and not just say, yeah, we cover Medicaid, we cover underserved, but has a measurable way to determine, how they cover the underserved, then absolutely. But it can't just be opened up for, and so this process and this bill, putting a mechanism in place will definitely address that.
Well, that's the problem with the bill, is now that it becomes exclusivity of access to care. Of course we provide underserved. I've been here for 30 years. I've taken patients with Medicaid. I still have patients under Medicaid. I have patients who don't have insurance. I provide pro bono care. During Typhoon Mawar, public health didn't go to the shelters, the Red Cross shelter, to help the pregnant mom, 16-year-old, 17-year-old, deliver the baby. I did. The Red Cross called me because they called public health, they were closed. There was nobody there. But they called a private physician, and I took that realm. I went there, and I delivered that baby for that mom who was high risk. So I wouldn't talk about the private sector not providing access to care to the poor or the needy. We do, and I've done it for 30 years, and I'm still doing so.
All right. As to the standards, I'm hoping that we can come to a consensus on that. Like Dr. Thorpe, you cited that we're citing the ECFMG, but not all of their recommendations, and we might want to take more of their recommended structure, for example, the supervision and the training, postgraduate training.
Thank you, Senator. I was specifically referencing the FSMB, 6 steps to their pathway for foreign trained physician licensing alternative pathways. So I would encourage the committee and the author to go back and harmonize the bill with the FSMB recent release here in either late January or early February with those recommendations.
Okay, thank you. All right. I can see that might be possible. And then can I just ask public health, this for me is it's kind of concerning. So you said that, the director said that the FSMB visited Guam on January 6th and shared best practices in other states and territories, but that is not provided here as testimony. What are the best practices in other states and territories, or any other recommendations? And I'm curious, why not? Why are we holding out on that? Why would not we share that? Why would we not? This bill was introduced in October. You know, the legislature's been looking at this since October. These guys came in January 6th, yet the author of the bill was not invited to meet with them or to hear firsthand best standards across the nation and what the rest of the government is hearing. It's kind of disconnected, and I can't help but question the intent of keeping that information from the legislature. Are there best standards? Do you have minutes from these discussions on best practices in other states and territories?
Senator Chalario, I will consult with the director and provide that to the committee.
All right, and then I guess whose decision was it to exclude the legislature on that? That was Public Health's decision?
Sorry, what's your question?
Whose decision was it to exclude the legislature from meeting with these experts regarding foreign licensure? The Federation of State Medical Boards.
To clarify, I believe there was an invite to the legislature. Senator?
I received a courtesy visit.
Oh.
Yeah. And then they had an event, I understand, somewhere, but I didn't attend that. So.
All right.
And that was just a meeting. It wasn't
yeah, even
to talk about legislation.
I can tell you that. Even the private sector, the Guam Medical Association, was not invited to the table. I don't think the Guam Society did it as well. But something that important, you would think that, you know, the best practices, like Senator Talai mentioned, is very important. And good that she asked, because I included that in my slide. In fact, 3 organizations provide best practices pattern. And I talked about it, and it'll take me hours to go through. And I gave Dr. Thorpe that entire report there. But it's actually very thick on the best practices. And this is what I'm talking about transparency within Gulf Guam, is that we have to earn the trust. And how can the private providers trust the government who shields us out when they create these legislations? They shouldn't do that.
Thank you. Does anyone know if this is done in any other area where they mandate that they practice full-time for a minimum of 3 years in a designated health professional shortage area, medically underserved area, or facility serving a medically underserved population? Is this the federal requirement? Okay, so this is the language of the federal requirement. Guam is saying we're going to encourage them. It doesn't look like, I was one to know how we're going to do this as well, but it says we're going to adopt rules and regs to encourage and facilitate the placement of such licensed foreign medical grads in public healthcare settings, including through memorandum of understanding, employment agreements, and service incentives, and then we have a preference. How do you expect this preference to work? It says preference is given to applicants who agree to serve in these public health facilities for a minimum of 3 years. And then the designated public health facilities are GMH, DPHSS, and the community health centers or other government. Have you seen that done in other states where they designate exactly which facilities are going to receive preference?
I haven't seen any. I've never looked. I never researched it. But you know, that requirement is the federal requirement that the foreign trained physicians practice in a HIPSA area, and so I think what the bill is trying to do is ensure to follow the spirit of that, is to ensure that when we do adopt it here, that these physicians do practice in these types of facilities.
Yes.
If I may, I would just point out that the HIPSA classification is not specific on the facility, but in the geographical region. So the entire Guam territory is under that classification. So that's And then I would just make a corollary for what it's worth. As a Canadian American, the Canadian has a similar pathway for licensure of foreign trained physicians, and it is also to rural areas with a close supervision mechanism from peers in the community for a period of time, and then as competency is assured, then it's transitioned to independent trusted practice for what it's worth. Different jurisdiction.
All right, thank you. And then does public health have any finding on this with their discussions with the FSMB regarding this limitation to certain facilities versus a geographic limitation?
Senator Chalahi, at this time I can't answer that question, but I can definitely get back to the committee.
Thank you, Senator Chalahi.
Thank you.
I did have some follow-up questions regarding the
Can I
FS.
just add one more point to that? I don't think it was brought up. That's a good question. It does not. The correct answer to that is no. The federal law does not require you to say assign to GMH, assign to public health. The public law, all it says is that the CONRAD 30 and the J1 waiver program, if they're going to go to CONRAD 30, is just a shortage area, which Guam is designated, which applies to the whole island and not just specific facility. This is why I said that section of that bill is discriminatory against patients. Against patients, not discriminatory against clinics, but because patients should have access to whatever clinic they go to.
Thank you, Dr. Shea. I did have a follow-up question regarding the FSMB, because it did state in the public health testimony that this has been a 6-month effort involving collaboration between public health, Guam Board of Medical Examiners, GMH, Guam Behavioral Health and Wellness Center. Ms. Brianna, can you tell us how often, I guess, these meetings have been taking place? Was it like a monthly meeting, a weekly meeting?
Senator Matanane, I'm sorry, I cannot answer that question because I'm not privy to the meeting details, but I know when the board chair reached out and along with our deputy director for me to research.
I'm sorry, which board chair?
Sorry?
Board chair?
Board chair, Dr. Berg.
Okay.
Yes, so that was just recent in maybe December. But I don't know, I cannot provide you with how often they meet and when they meet. But I can definitely get that information.
Do you know who were the representatives? Was it the director of each agency, the chairperson of the GBME, any other doctors?
I'm not certain. I can say it's the director of public health, Deputy Peter John, Dr. Berg. I'm not certain with it. And then Guam Behavioral's deputy director. I'm not certain of all the other members who meet.
Dr. Shea, you are the president of the Guam Medical Association. Are you, you mentioned that you were surprised also about this bill coming from the governor's office and also weren't necessarily aware of Bill 206. Are you aware of any members of the Guam Medical Association participating or providing input on the bill that's coming out from the governor's office, or Bill 206?
No, in fact, we were completely shielded from any of those meetings. And, you know, I think this is what I talk about government. The government has to be more transparent to earn the trust of the people. And, you know, physicians were part of the people. And this is why we lose trust in the government system, because there's really no transparency. When you talk about quality practice and supervisory roles, et cetera, you know, we already offered our help. We want to help. Putting our differences aside, putting our personal opinions aside, this is how legislation is crafted. We want the differences of opinions to be inputted. This is why we spend the time to come here to give you those input. And as truthfully I can speak, technically I don't hold anything back, but I did hold a few things back today, but I think it's really sad that, 30 years in practice here, that what I witnessed through the politics of healthcare is really sad. And I've been accused of certain things here and there, but my whole goal on Guam is to help improve care. For 30 years, I don't need any more patients. I'm not in that competitive mood. I'm here to see when I do retire and go into the sunset, what can I leave behind here for all the generation. I've delivered over 11,000 babies here. I'm delivering babies of the babies I've delivered. So I want this to continue. I want. And this is why I'm open to work with Senator Taitague, to work with the legislature. Even if the governor calls me and say, hey, Tom, we want to include you. Provide us your input. It may be an insincere gesture. Okay, I'm being offensive again. But the truth be told that, I tend to rub people the wrong way sometimes. And, I apologize for that. But, it has to be said. It has to be said. And the only time I found out about this bill was from your email. It says, hey, we want to invite you down to give a testimony. And, I caught that. So I was able to reschedule my patients, and I'm being here today.
Well, we certainly appreciate you coming down. It's always good to hear from people that the bills that we introduce affect, because it's your input that only strengthens the bill, even though sometimes it should be as we're crafting it. So thank you so much, Dr. Shea, and I certainly understand how you feel sometimes when you speak up or you speak out and you take the hits for it later. So keep on fighting. Senator Taitague?
Thank you, Madam Chair, and thank you to my colleagues. I know it's not a very simple bill. There are some parts, a lot of parts to it, but it does run very smoothly if you understand first what the CONRAD 30 is all about, as well as the J1 visa. Then you can kind of get a grasp, and then you have to get a grasp on what is Guam going to do to allow certain doctors to come here and practice. What requirements will they need? And most especially, and I agree with you, Dr. Shea, about our Guam Medical Board Association. They're not too keen on, hearing from the public or whether something could be possibly work, and just push it aside. I think David Lebowski kind of said it for me on some of the reactions we get from the Guam Medical Board. So what I want to do is to formalize exactly the guidelines they have to follow, the SOPs they have to follow to allow foreign doctors into Guam, to not hinder it. And that's what basically the bill is going to do. But I greatly appreciate everyone coming to the table like this and making the suggestions. I did have some questions, but I know we're kind of pressed for time because we do have the State of the Island address. But I just want to say in closing, Madam Chair, that I look forward, of course, to working with the chair and incorporating suggestions and regarding the including. And I will take definitely the time to reach out to everyone that's here today and ask them to let's sit down and have a powwow. I'm one about getting a round table and a working group together to make something better, because we do serve the people of Guam and we only want the best for them. I'd love to include the nurses as well, to find a way in section, because that's one of the areas that we really need assistance with. And of course, the other suggestions that were made. I even have an amendment myself, but I appreciate also Department of Public Health and Social Services support for the intent of Bill 206-38 and recognize the urgent need to address a physician shortage on Guam. However, this legislation is not a reactionary proposal. It is a result of more than 6 months of careful review, consultation, and consideration on Guam's healthcare landscape. In fact, I even mentioned this about 6 months ago, how I've been working on legislation like this to allow foreign workers. And I do remember Senator Rodriguez, trying to push the envelope on that, and what happened that it didn't go through. So let's continue, to carry that torch. And hopefully this legislature will finally get it through. And however, waiting for a separate executive proposal doesn't preclude us from collaboration. It wasn't until after I introduced this bill that I heard the governor wanted to introduce a similar bill. I did reach out, provided my assistance, and made suggestions to work together in collaboration. However, I was not included in those meetings. In fact, the person heading that was Art St. Augustine. I mean, I went as far as you were asking, the chair was asking you later who was part of this meeting. Well, Art St. Augustine was holding it. He was I guess, the chairman of this group, and I asked to be included, but they didn't include me. Then I asked to be invited to the meeting of the FSMB that we're visiting on Guam, and they didn't include me. But, you know, I'm used to that stuff, just like you, Dr. Shea. Maybe I rub people. Maybe
like
I rub
I said, you got to be inclusive and not exclusive. And you know, I respect Dennis Rodriguez, but it's got to be inclusive.
Well,
and
I tell you, I'm used to it. I'm used to people taking things that I've worked on and trying to claim it for themselves. That's a classic thing but it's not. I'm Team Guam. You know, if I bring up an idea and then you want to take it and make it yours, I'm going to be there to help you. You know, go ahead, take it. But I did reach out, Madam Chair, as you were asking the questions, to try and, with collaboration. And you know, the legislature has always been ready to stand to work with the governor's office. And we will invite the governor to work with us on this bill. And, leave the door open, but we cannot pause meaningful progress when the needs of our patient are immediate and ongoing. So ultimately, this bill is a part of a broader effort to respond to what I consistently heard from the medical community. And we need more physicians, not just in the government sector, but also the private sector. And I appreciate all the, I do have your printout and your notes underneath your printout. I will look at that and again, reach out to those who are here today. I hope that the doctors and healthcare professionals and the people of Guam will stand behind this effort. This bill is not a silver bullet, but it is a meaningful step forward, building a stronger and more resilient healthcare workforce for our island, and one that serves our people with care, dignity, and timelessly. They deserve the best, only the best. So I look forward to not just a markup meeting, but I'm looking forward again to the governor's bill. Maybe we can incorporate some of her ideas into my bill, or 2 different bills coming out. You know, I don't mind, whatever works, whatever gets the job done, but the most important thing is collaboration and bringing the stakeholders in on working on both legislations to allow their input. And especially, we are not experts, so we really need the collaboration of those who are here today, as well as those who are willing to work with this body. So that being said, thank you so much, and looking forward to working with you, Madam Chair, on this legislation.
Thank you, Senator Taitague, and thank you to Dr. Shea, Dr. Thorpe, Mrs. Manjola. Thank you to Public Health, Ms. Sablon, but you're probably going to be here for the next bill, correct? So that concludes the public hearing on Bill 206. We will now proceed to accept testimony on Bill 238, introduced by Senator Vince Borja. If you are here to testify, please come to the table. And before we accept testimony, Senator Borja, you may open on your bill.
Thank you, Madam Chair. Holiday colleagues, GDOE, Mr. Anderson, Ms. Muffness, Public Health, thank you for coming down. I'm gonna try and keep this short because I'm in a hurry too to go get ready to change for the State of the Island address. But I think the bill that I know that the bill that we have is very straightforward. This bill was introduced at the request of the former superintendent and his team. I know the new leadership is in support of the same bill. So thank you guys for coming. The intent of the bill is to address the sanitary permit, which expired in 2023 during the renovation delays under the former administration and former superintendent. And because that permit is expired, the school is now legally classified as a new applicant as it goes through the public health inspection. That classification automatically triggers a 2-year new applicant requirement, including a zero deficiency pre-operational inspection standard. FBLG is not a new facility. It's an existing public school with prior compliance history. If this measure is not adopted, reopening of FBLG will be delayed. If reopening is delayed, that the elimination of double session will also be delayed, which is why I'm in support of getting this measure passed. The consequences of that delay, again, doesn't just affect us or the department, it ultimately affects our students and their families. FBLG and Okuru students have endured double sessions for years. They deserve the same full traditional school day that other schools already are able to provide. What I want to make sure that I address that this bill does not do, it doesn't eliminate public health inspections. It doesn't remove the authority of the Department of Public Health. It doesn't waive compliance with sanitation laws. FBLG will still be inspected, the violations can still be cited, and the corrections will still be required. What this bill does is it removes the automatic 2-year new year applicant period that was triggered solely because the permit expired during construction delays. We're not trying to lower standards. This is about correcting technical classification that does not reflect the reality of this facility. Safety still remains mandatory, oversight remains intact. This bill ensures that we do not prolong double sessions over a procedural issue that does not improve public health protections. That is why I introduced this measure. With that, I conclude my opening and I look forward to the testimony. Thank you, Madam Chair.
Thank you, Senator Borja. We will begin with, let's start with public health.
Half-a-day Senators, my name is Leilani Navarro. I'm an Environmental Public Health Officer Administrator with the Division of Environmental Health with the Department of Public Health and Social Services. I'm here to read the written testimony from Director Ariola, who had to step away for a meeting. So here it goes. Half-a-day Senator Sabrina Salas Matanane and members of the 30th Guam Legislature. My name is Teresa C. Ariola, Director of the Department of Public Health and Social Services, or DPHSS. Thank you for the opportunity to provide testimony on Bill number 238-38, an act to amend Section 25105 of Chapter 25, Division 2, Title 10, Guam Code Annotated, relative to the granting exemption of Title 26 of the Guam Administrative Rules and Regulations related to sanitary inspection requirements and for other purposes. As you know, the Division of Environmental Health, or DEH, within DPHSS is mandated under Sections 2105 and 21102 of Chapters 20 and 21, Title 10 Guam Code Annotated, to adopt, implement, and enforce rules and regulations to ensure necessary to ensure the sanitary operation of health-regulated establishments, including public schools. These requirements exist to ensure that facilities serving children, educators, and staff meet minimum health and safety standards before they are occupied and used. For purpose of clarity, it is important to distinguish between the three types of school inspections that DEH conducts. Number one, pre-operational inspection is an inspection conducted prior to the issuance of a school's initial sanitary permit to determine compliance with physical and structural requirements, such as the presence of functional plumbing, lighting, and electrical systems. Number two, renewal inspection is an inspection conducted prior to the issuance of a renewed sanitary permit pursuant to Public Law 37-04. And number three, compliance inspection is an inspection conducted of a school after the issuance of its initial or renewal sanitary permit to confirm compliance with governing laws and regulations. These distinctions are important because Bill number 238-38 proposes to waive the pre-operational inspection, which is the only inspection designed to verify that a school facility meets the minimum sanitation and safety requirements before students and staff occupy the building and use the facilities. The circumstances leading to Bill 238-38 are clear. The Guam Department of Education, or GDOE, made a deliberate decision not to renew the sanitary permit for FB Leon Guerrero Middle School, or FBLGMS, when it expired on June 30, 2023, because the facility would not pass inspection due to planned renovation and construction activities. As a result, the school has not held a valid sanitary permit since then and has not been included in DEH's annual inspection of GDOE schools, as required under Public Law 37-04. GDOE's decision not to renew FBLGMS permit properly acknowledged that the facility could not meet existing sanitary requirements. The last formal DEH inspection of FBLGMS occurred on January 13, 2011, which resulted in a score of 4 demerits and a letter grade of A. See enclosure A to this testimony. While this outcome was satisfactory, the inspection occurred more than 14 years ago. Since then, the facility's condition, maintenance status, and compliance with current updated standards are unknown. Moreover, DH records show a history of this school's closure from a failed inspection, which occurred on March 26, 2009. See enclosure B of this testimony. Because FBLGMS does not have a valid permit, it cannot undergo a renewal inspection. Because no permit has been issued, a compliance inspection is also not applicable. The only appropriate pathway for FBLGMS is a pre-operational inspection, which Bill number 238-38 seeks to eliminate for that school. In October 2024, DEH conducted a plan review for the school's renovation project. See enclosure C of this testimony. That review identified several deficiencies as noted in the yellow highlights and the additional items listed which could not be verified for compliance based on the submitted plans. Because a pre-operational inspection has not been conducted, DEH cannot confirm whether these issues have been addressed or not. This places unnecessary threat of harm to the school's anticipated occupants. This department has been working diligently in ensuring every one of GDOE schools is inspected timely prior to the renewal of their sanitary permits. In return, GDOE has been doing its best in making sure these schools are prepared to pass our renewal inspections. So far, both departments have fulfilled their obligations to the community and Public Law 37-04 in that effort. Bill 238-38 undercuts our accomplishments and the very purpose of laws and regulations that have been enacted for school sanitation. Section 2 of Bill number 238-38 presents several policies and implementation concerns that compel this department's opposition to the bill. They are, number 1, the bill proposes to amend the actual law governing institutional facilities, which is Title 10, Guam Code Annotated, Chapter 25, rather than amending the applicable regulations. This extraordinary action bypasses established regulatory processes and would create a permanent statutory exception that is applicable specifically to FBLGMS, unless future legislation is enacted to reverse or revise it. Number 2, this section of the bill requires FBLGMS to comply with the rules and regulations governing the issuance of sanitary permits, or Title 26 GAR, Chapter 4, Article 5, except for Section 4505F. Thus, it waives the school from passing the pre-operational inspection before a sanitary permit is issued. The bill provides no alternative standards, no substitute criteria, and no mechanism for verification of compliance. A renewal inspection cannot substitute for this requirement because it only occurs after a permit is issued. Number 3, By exempting FBL-GMS from all new application requirements, the bill would allow issuance of a sanitary permit without an application, without payment of required fees, and without meeting the minimum standards required of every other school facility. Number 4, if FBL-GMS is not to be treated as a new applicant and thus waived from the pre-operational inspections as proposed in Bill 238-38, then how is the school to be addressed? It cannot be categorized or processed as a renewing applicant since it does not have a sanitary permit to renew. Number 5, if the intent of Bill 238-38 is to allow operation of FBL-GMS without meeting all the requirements of the school regulations, then the bill effectively nullifies the purpose of the sanitary permit issuance. Sanitary permits are not symbolic documents, they are certifications of minimum public health compliance. And lastly, number 6, providing a statutory exemption for one facility sets a dangerous precedent that other health-regulated establishments could reasonably seek, potentially undermining the uniform application of public health laws. In essence, Bill number 238-38 would authorize the operation of FBL-GMS without confirmation that minimum health and sanitation standards have been met. The department cannot support any measure that compromises student safety or weakens public confidence in the sanitary permit process. DPHSS remains committed to working collaboratively with the legislature and GDOE to support the timely reopening of school facilities within the framework of existing public health laws. However, this department cannot support action that circumvents inspections or waives critical safeguards that help protect the health and safety of our students, educators, and staff. Undang ko lang na si Diyos maazi, signed Teresa C. Ariola, MBA. Thank you.
Buenas noches, Senator Matanane, Madam Chair, Senator Borja. My name is Christopher Anderson. I'm the Administrator for Student Support Services Division with the Guam Department of Education. Accompanying me is Ms. Melissa Mofnis. She's the principal for FB Leon Guerrero Middle School. We are both members of the School Readiness Task Force and here to represent Dr. Wampat, who unfortunately couldn't be here due to critical matters. She has provided written testimony, and we're here to read that testimony and then be able to answer any questions you may have. Dear Chairwoman Matanane and Senator Borja, Sizus Masi for your continued partnership and support of the Guam Department of Education. I respectfully submit this testimony in support of the bill and the bill's intent and greatly appreciate your leadership in this process. More specifically, the Guam Department of Education respectfully requests clarifying language to allow 2 consecutive renewal periods under Title 26 Guam Administrative Rules and Regulations, subsection 4505, which I believe is the sanitary permit applications for new and renewal, be extended through June 30th of 2027, thereby preventing FB Leon Guerrero Middle School from being classified as a new applicant solely due to prolonged inactivity resulting from refurbishment and procurement delays. The Guam Department of Education remains fully committed to maintaining the highest standards of student safety, public health, and regulatory compliance, as this is fundamental to the department's mission and public trust. Prior to its closure, FBLG Middle School consistently met health and safety standards. However, procurement and contract delays prevented FBLG from renewing its sanitary permit back in June 30th of 2025. The department is confident that it can meet the sanitary inspection requirements, but reclassification as a new applicant that requires an inspection with 0 deficiencies would only further delay reopening, disrupt student learning, and unnecessarily strain agency resources. The FBLG campus was closed in December of 2022 due to structural integrity concerns. In January of 2024, the department awarded a refurbishment contract to Northern Construction to rehabilitate most, but not all, of the facility. The scope of work included roof repair, canopy replacements, selected HVAC installation, electrical upgrades, interior and exterior painting, installation of interior wood and exterior metal doors, and limited tile replacement. These improvements were designed to restore functionality and safety. It did not constitute new construction. The Merriam-Webster dictionary defines refurbishment as making something look new or functional again. It involves restoring something to its original or good condition, such as updating buildings or repairing equipment. We provide this definition primarily to make a distinction between a renovation and or a reconstruction project. This is a refurbishment project. Although substantial completion is anticipated in April or May of 2026, several major areas remain unfinished and require additional work by facilities and maintenance or a division or future contractors. These include, but are not limited to, the gym structure and flooring, restroom tiles throughout the campus, the removal of an abandoned building, perimeter fencing, window screens for fast-track classrooms, H building, first floor toilet and laundry facilities for special education students, water isolation valves, installation of double doors for electrical and mechanical rooms, and conversion of the gym roll-up door to a double door configuration. In addition to uncovered facility work, several critical items require funding and procurement action, including educational equipment for classrooms and offices, an integrated network and telecommunications bell system, fire alarm and suppression systems, 7 HVAC units and ductwork for the cafeteria dining area, and 500-gallon water heaters for the cafeteria and the gym. These items may not be completed until well until next school year. So given these realities, requiring a zero deficiency inspection standard at this stage would not reflect the operational realities of this refurbishment project. The FBLG community has patiently waited over the past 4 years to return their campus, and it is incumbent upon all leaders to collectively set the conditions necessary to bring it to fruition. Allowing FBLG to undergo a sanitary inspection by extending the inactive period of its sanitary permit to June 30th of 2027 is a reasonable request. This action not only maintains regulatory oversight by the Department of Public Health and Social Services, it preserves the integrity of the core health and safety requirements outlined in Title 26 of the Guam Administrative Rules and Regulations. Bill 238-38, with the proposed clarifying language, provides a balanced and responsible approach that is student-centered, preserves regulatory integrity, and acknowledges practical rehabilitation timelines. It balances accountability with pragmatism and enables DOE to responsibly open FBLG and minimize continued displacement of students. On behalf of the department, I respectfully urge the 38th Guam Legislature to support Bill 238-38 with clarifying language. Again, Jesus Maasi for the continued partnership in education, Sinceramente, Judith Wampat, Acting Superintendent of Education. Thank you.
Melissa, were you going to? No? No? Okay. Senator Borja?
Thank you, Public Health, for coming. My only question is, because of course the intent, right? And we understand the health, the sanitation and health requirements, and we want to ensure that we're not compromising that. I think what's important, and I think the position that the committee and we want to take is, we're not saying throw all this out the door. I think what I was looking for in her letter was all the reasons why we shouldn't do it, but how can we meet the intent of the department, which is we don't want to delay reopening FBLG for students to come back so that we can end double session. And so what are some suggestions in regards to, I get the whole you can't issue a permit, reapplication permit if there is no current permit. So we understand that. But what we're asking right now, and what the school is asking for the community, is if we can just re-inspect it as if there was an opportunity for it to get renewed. because there was no opportunity because it was under refurbishment. We didn't rebuild a new school. So what is the agency's advice in regards to how we can amend this so that, again, we're not, there are some technicalities, I guess, but what they're saying is still inspect us, but how can we get a permit without having the zero deficiency, right? Because that is how new permits are treated. Is that correct?
Yes, so the department's position is we are asking the legislature to ensure that the distinction between pre-operational and renewal inspections are kept, and that all health-regulated establishments are held to the same standards, which is when it's a pre-operational inspection, they have to pass all minimum health and safety requirements, which are detailed in the appropriate rules and regulations. Because we as a public, similar to other public health systems in other jurisdictions, pre-operational inspections are actually there to prevent hazards before the students even come back to the facility, right? So if by making sure that the facility complies with all the minimum requirements before the students are there, then the hazards, can be prevented. Versus when a facility which was renovated, and when I look at GDOE's testimony, it actually mentions that there's gonna be some building structures like gym, restrooms, perimeter fencing, window screens, toilets, educational equipment. I'm assuming these are the chairs and tables for the students. They said it's not going to be ready until next school year. So I think as a community, the public and the parents are relying on us to make sure that those systems are in place before the school can even open.
But you have current schools right now where like some of the portions of the schools are shut down. How is that any different? Like then if the gym is not ready, we need the classroom. So shut down the gym if that's the case. Can we do that? Because right now, at least my understanding is because of the state or how it's going to be inspected without this bill is that it can't have any deficiencies. Is that correct?
Yes, that's how all pre-operational inspections have been.
So this is where we're asking, right? The community is asking, and the schools is asking is, so what, how do we? Because it's not a new school. Like yes, there was refurbishment, there was construction done, but it's just like GW when it went through refurbishment. They didn't have to go through an initial inspection. That has not been done. Is that correct?
So Section 21-102 D and E. Of Title 10, Guam Code Annotated, Chapter 21, actually requires any health-regulated establishment, such as a school, to submit plans and specifications whenever they either construct, renovate, or remodel any facility, especially when the renovation or reconstruction or remodeling affects health-regulated building systems, such as toilets, usable space for the students. So that actually is required in the regulations. And when the facility, we allow a facility to open and receive a permit, it's going to be harder to correct any structural deficiencies when the students are already there, because it's going to be disruptive. It's going to be harder to do any further renovation while the students are there. And it also weakens the incentive for the school to correct the remaining deficiencies.
So again, I guess my question is going to circle back to, this is not like a special favor. This is a special circumstance that really the construction pushed this to. So, which is why I get it. If we throw this bill out the door and we just stuck to the rules and the GCA and all of that, then there would be no need for us to have this discussion, because this is important for us to get double session, and I get it, we're not saying because of double session, like, let's throw all safety and health standards out the door. What we're asking is, how do we get an exception that helps get the school open and not have to be held to the same standard as if a new building was built and we have to go through the entire process? Because if you're just gonna say no, then that's where the legislature is trying to say, hey, we understand the circumstances and the situation. We want to work with public health to ensure that it's still safe and it's meeting the health and safety standards. But based on this testimony, you guys are saying that you're pretty much saying you don't want to try and change anything. You want us to try and stick to the law. But that's why we're having this conversation. So what is the now I'm not going to say the workaround, but how can we work to address this? Because the concern is it's been shut down for too long. We need to work with you guys to ensure, I mean, you know, so that we're not just saying, disregard what you say, the law, we're just going to waive the law so that they can do it. How can we do it so that we don't have to do that?
That is hard to answer, especially because our, you know, we try to uphold public health standards. Right? So, and we want to make sure that the regulations apply to everyone so that it's fair and we maintain the public's trust in the permitting system.
Go ahead.
If I may just rebut, and by the way, just to clarify, Leilani or Public Health and DOE have a very good working relationship, and over the last couple of years in trying to make sure that our schools are meeting the sanitary requirements to be issued permits. But as Leilani had mentioned, that's actually our point, that there is a lot of work that is not included in this refurbishment project that needs to be done. And we're not asking to open the school before this work is completed. But what we are asking for is a reasonable expectation for us to be able to meet the sanitary inspection requirements as if we were being inspected in June 30th of 2025. And specifically, the language that the department is asking to include in the bill is specifically the extension of the inactive period. Because the only thing that puts us in this category of pre-operational requirement as a new applicant is the fact that we've surpassed the inactive period. Now, if the law is passed or the bill is passed and it is extended, we are still being inspected, but with the category of a sanitary inspection, which allows us up to 40 demerits. And again, I'm not saying that we're trying to get to 40 demerits, but the idea is we have a greater chance of success in getting the school opened safely under the condition of a sanitary inspection versus a new applicant. And that's the ask, really, for the Department of Education. We respect and acknowledge the standards that public health has for the safety of structures, and we want to comply with that without a doubt. The issue is if we are to meet the 100% expectation with no demerits, I mean, that's very, very difficult to meet, especially that a lot of this work is not included in the refurbishment project. Thank you.
Yeah, so, you know, just to wrap this up, really, I mean, as we continue to work through this in markup, I definitely like to work with public health to really address that main concern, right? Is we understand the requirements for new permits and it's expired, so now it has to be treated because you can't issue a reapplication without an initial because the initial doesn't exist technically, right? Just so we're all tracking. But yeah, it's definitely something important for us in the community, and we want to continue to we will work with you in regards to ensuring that we have language that still requires those safety requirements, health and safety requirements, with an opportunity to not expect everything to be perfect. I think that's the ask. We can't expect everything to be perfect, but of course, without compromising safety and health requirements for the department. And we'll continue to collaborate as we work through markup with you guys and the department to ensure that. Because again, the bottom line here, and just to emphasize, and I know it's not your problem, is double session, which has been a very long-standing problem that we have committed as a legislature to address, and we hope to get you guys input as well as we move through this. But thank you for coming down. Thank you, GDOE, and thank you, Madam Chair. I have no further questions.
Madam Chairwoman, if I can, I know Dr. Wampat did not include in her testimony comments on the classrooms that are being constructed on the Guam Housing Corporation property, which is across from FBLG. But there is work or planning being done right now to construct 24 classrooms with the existing structure. I think this is the GHC housing area. They're going to renovate or they're going to refurbish or whatever they do with those classrooms, the building to make 24 classrooms. And then I believe they have somebody who's going to erect 20 other additional classrooms, so a total of 44 classrooms. What Dr. Wampat is wanting to do is include those classrooms in the footprint of FBLG. And so I know Senator Borja mentioned the issue of double session. I know there's some talk about the possibility of Simon Sanchez, operating out of FBLG's facility with those classrooms. But obviously they need FBLG in order to make that course of action feasible. But just to put it on the record, Dr. Wampat would like to include that project that's going on across the street as part of FBLG's footprint. And we would like to work with Public Health, of course, when we submit our application for inspection, that they could include that. Thank you.
Thank you, Mr. Anderson, Ms. Mofnes, and Public Health for attending today's public hearing on Bill 206. I don't have any questions, but I truly do hope that we could come together and find a solution. Oftentimes it's unfortunate as policymakers that things have to escalate to where legislation is needed when sometimes it's just talking to each other, collaborating, and working together. So again, that concludes today's public hearing on Bill 206 and Bill 238. Thank you to everyone that testified today. The time is now 4:25. The public hearing held by the Committee on Health and Veterans Affairs is now adjourned. Sidzo Ismasi.